Stroke is the fifth leading cause of death in the United States. And knowing the signs can sound the alarm to get help. From numbness or weakness in the face, arm, or leg, to confusion, trouble speaking or understanding speech, problems seeing in one or both eyes, dizziness, loss of balance, coordination, or trouble walking, severe headaches, fainting, or seizures can all be signs of a stroke.
If you get a headache that people describe it as the worst headache of their life, and it's very sudden, that could mean you have a ruptured blood vessel in your brain.
If any of the symptoms of this major health event creep up on you without a known cause,
it's as urgent as a heart attack.
Something Laura experienced herself.
Last year, in July, I got admitted for a mini stroke.
The mini stroke started with pain and discomfort she initially wrote off as nothing more than an inconvenience.
I started feeling numbness on the left side of my face, and I thought maybe it was just my migraine and it just was not going away.
Not sure what to do, she called her doctor for advice.
He said, well, what's your blood pressure? So I had somebody up here take my blood pressure. It was almost 200 over 130.
A normal, healthy reading is 120 over 80.
I'm thinking, okay, well, it'd be good for the stroke coordinator to have a stroke right in her office. So I went down to the emergency room.
Where she and any other patient with her symptoms would be immediately evaluated.
For both instances, we will do a stroke alert overhead, so everyone is aware that there is a stroke patient coming in the ED somewhere, so either from the front door or by ambulance.
As soon as stroke patients are admitted, providers need to run multiple tests quickly.
I always tell the patient there's going to be a lot going on, so I will go with the patient, we go straight to the CT scanner, and they want to get that CT scan within 10 minutes.
Time is everything.
Time is brain. Like with a heart attack, time is heart muscle, time is brain. For every minute that a stroke goes untreated, 1.9 million brain cells could die.
Stabilizing patients is of the utmost importance.
You can get anything that's out of control into control, like lower your blood pressure, sometimes give you a blood clot dissolving medicine if you are in the window to get that.
People may notice a change in motor function after a stroke. Chelsea says they'll run multiple tests to make sure patients can perform simple tasks without issue.
If they meet criteria, we'll give them some water and we see how they swallow it, and we make sure that they don't cough, choke, anything like that. If they do, we immediately stop them, and we actually have to have the doctor, usually the inpatient doctor, order like a swallowing screen with an actual speech pathologist to make sure that it's safe for them to eat normal food and drink normal liquids.
When needed, physical therapy is a key component to rehabilitation, helping patients get back to the way they were before the health event.
It's a mental toll on the patient.
No matter how stressful the experience may be in the hospital, Laura says it's nothing in comparison to the long-term damage.
If I could impress on anybody to not wait, don't think that the symptoms are going to go away, get to the hospital.
For Arnot Health, I'm Lexi Cutmore.